Have you noticed itchy skin that doesn't seem to go away, trouble seeing in low light, or small yellowish bumps near your eyes that you thought were just part of aging? What if I told you? These could be early warning signs that your liver is struggling. The truth is, your liver works behind the scenes every single day, performing over 500 essential functions, filtering toxins, breaking down fats, storing vitamins and minerals, balancing hormones, and helping your immune system stay strong. And yet, when something goes wrong with your liver, it doesn't always give you loud, obvious symptoms. Instead, it whispers through subtle changes in your skin, your digestion, your eyes, or even your fingernails. Liver disease now affects about 1 in 4 adults, and most people don't even realize it until it's advanced. If you're over 60, your risk goes up significantly, partly due to long-term medication use, slower metabolism, and the natural wear and tear that comes with aging. Over the years, medical experts have seen how often these early signs are ignored or brushed off as just getting older, when in fact, they could be your body's way of telling you something important. The good news? Your liver is one of the only organs in your body that can actually regenerate itself. But that healing can only happen if you catch the signs early and give your liver the support it needs. In this video, we're going to walk through 7 unusual, easy-to-miss signs that your liver might be in trouble. These aren't the typical symptoms your doctor usually talks about, but they're worth paying attention to, because catching them now could protect your health and your independence in the years to come. So, if you're someone over 60 or you care for a loved one who is, I encourage you to watch all the way to the end. And if you find this video helpful, be sure to click the like button, subscribe to the channel, and leave a comment below to let us know which sign surprised you the most. Your story might just help someone else catch these early warnings in time. 1. White or yellow bumps around the eyelids, xanthelasma. Take a moment to look closely at your eyes in the mirror. Do you see any small, soft, yellowish, or white bumps around your eyelids, especially near the corners or along the lash line? These spots are called xanthelasma, and while they may seem like harmless skin changes, they could actually be an early signal that your liver is having trouble. Xanthelasma are cholesterol-rich deposits that form just beneath the skin. When your liver is working properly, it helps manage cholesterol levels by breaking down fats and clearing excess lipids from your bloodstream. But if your liver is inflamed, sluggish, or dealing with fatty liver disease or poor bile flow, that cholesterol may not be processed efficiently. As a result, it builds up in the blood, and some of it may end up depositing in visible areas like the delicate skin around your eyes. Now here's where experience comes in. Over the years, many older adults have told me they thought these bumps were just a cosmetic issue, or just getting older. But from a clinical perspective, xanthelasma is often linked to underlying metabolic issues, like high blood lipids or non-alcoholic fatty liver disease, NAFLD. This is especially concerning because NAFLD is known as a silent condition. It can develop slowly over years without any symptoms, until significant damage has already occurred. That's why xanthelasma can be more than just a skin concern. It's one of the few visible signs your liver may be overwhelmed. In some cases, it also indicates that your cholesterol is out of balance, even if you feel perfectly fine otherwise. Medical studies have shown a strong correlation between xanthelasma and increased risk of cardiovascular disease and liver dysfunction, particularly in older adults. This makes it even more important to treat these bumps as a clue, not a coincidence. The challenge is that these spots don't itch, hurt, or bleed, so it's easy to overlook them. But ignoring them could mean missing a chance to take action early, before more serious health problems develop. Backhand index pointing right: if you notice yellow or white patches around your eyes, don't dismiss them. Speak with your healthcare provider. Ask for a complete lipid panel to check your cholesterol levels and a liver function test to evaluate how well your liver is working. These tests are simple, and they can make a huge difference in catching liver issues early, when lifestyle changes can still reverse the damage. 2. Pale, clay-colored, or floating stool. Let's talk about something most people don't like to talk about, but should. Your stool. Yes, it may seem like an uncomfortable topic, but the truth is, what you see in the toilet bowl can tell you a lot about what's going on inside your body, especially your liver. Under normal circumstances, your stool should be medium to dark brown. That brown color comes from bile, a fluid produced by your liver that helps break down fats and carry waste out of the body. But when your liver isn't functioning properly, bile production or bile flow can be disrupted, and that change may show up in your stool. If you notice that your stool is consistently pale, clay-colored, or grayish, it may be a sign that bile isn't reaching your intestines the way it should. Without bile, stool loses its natural color and becomes light. In addition, if it floats, appears greasy, or leaves an oily film in the toilet bowl, that's a sign your body isn't digesting fats properly, another job that depends heavily on healthy liver and gallbladder function. Now here's where expert insight comes in. Over the years, I've seen many patients, especially seniors, ignore this symptom for months, sometimes years. They assume it's due to something they ate, a sensitive stomach, or just aging. But in reality, persistent stool changes like this can be one of the earliest visible signs of liver dysfunction, including conditions like fatty liver disease, hepatitis, bile duct obstruction, or even cirrhosis. It's also important to note that pale stool may sometimes come and go. If it happens once or twice and then returns to normal, it might be nothing serious. But if it becomes frequent or is accompanied by other symptoms like itchy skin, dark urine, yellowing of the eyes, or unexplained fatigue, it's time to pay attention. Here's why this matters. A blockage in your bile ducts or inflammation in your liver can stop bile from flowing into the digestive tract. That's not just a digestive issue. It's a sign that your liver is under stress and possibly progressing toward more serious disease. The bottom line? Your stool can be a window into your liver's health. It might not be the most glamorous topic, but it's one of the most reliable ways to catch trouble early, before it becomes dangerous. Backhand index pointing right. If you notice persistent pale, clay-colored, or greasy stool, talk to your doctor. Ask for a liver function test, and in some cases, an abdominal ultrasound to check the bile ducts and liver tissue. These non-invasive tests can help detect inflammation, blockages, or early-stage liver disease. Don't ignore what your body is flushing out. Sometimes the liver whispers through your digestion, and listening could be the key to staying healthy, independent, and active for years to come. 3. Poor night vision, nyctalopia. Have you noticed it's getting harder to see clearly in dim light? Maybe you find yourself squinting when walking down a hallway at night, turning on extra lamps around the house, or struggling to drive after sunset. While it's easy to blame poor night vision on age or cataracts, this symptom could actually point to something deeper, an issue with your liver. Your liver plays a crucial role in helping your eyes adapt to darkness. One of its key jobs is storing and transporting vitamin A, a nutrient that is essential for healthy vision, especially in low-light environments. Specifically, the liver produces retinol-binding protein, which carries vitamin A through the bloodstream to the retina, where it supports light-sensitive cells. When your liver is not functioning properly, due to inflammation, fatty liver disease, hepatitis, or cirrhosis, its ability to store and distribute vitamin A declines. That means even if you're eating enough vitamin A-rich foods like carrots or sweet potatoes, your body may not be delivering it to your eyes where it's needed most. Over the past 10 years, I've seen this pattern in many older patients. They don't have major vision problems during the day, but as soon as dusk falls, they notice the world around them becoming blurry, shadowy, or harder to navigate. Some even describe bumping into furniture, misjudging stairs, or avoiding driving altogether after dark. In some cases, this poor night vision was one of the first visible signs that their liver was struggling quietly in the background. What makes this symptom tricky is that it's often mistaken for normal aging. But when combined with other subtle clues, like fatigue, itchy skin, or changes in stool, it becomes much more meaningful. If your body isn't getting enough vitamin A to the retina, nyctalopia, or night blindness can gradually develop. It's also worth noting that some medications commonly taken by seniors can further impair vitamin A metabolism, adding more stress to an already weakened liver. That's why monitoring this symptom and looking at the full picture of your health is so important. Backhand index pointing right. If you've noticed your night vision worsening, especially if it's a recent change, don't ignore it. Talk to your healthcare provider and ask for both a liver function panel and a vitamin A blood test. These simple tests can uncover hidden deficiencies or liver stress long before major damage occurs. Poor night vision isn't always just an eye problem, it can be a signal from within. And catching it early gives you the chance to support your liver, improve your nutrition, and stay safer in your daily life, especially after dark. 4. Swelling in the right foot or ankle, peripheral edema. Have you noticed that one of your feet, especially the right one, seems to swell more than the other by the end of the day? Maybe your socks leave deeper marks, or your shoes feel tighter than they used to, even though your weight hasn't changed. This kind of persistent swelling, known as peripheral edema, is often brushed off as just poor circulation or a normal part of aging. But in many cases, it's actually a sign that your liver may be under strain. Here's why. One of the liver's vital functions is to produce a protein called albumin, which helps maintain the right amount of fluid in your bloodstream. When your liver becomes damaged due to conditions like fatty liver disease, cirrhosis, or chronic inflammation, its ability to produce albumin decreases. Without enough albumin, fluid starts to leak from your blood vessels into nearby tissues, especially in areas where gravity pulls it downward, such as your feet and ankles. Now, why does it often appear first, or more noticeably on the right side? That has to do with how blood flows through the liver and returns to the heart. When there's increased pressure in the veins leading into the liver, something known as portal hypertension, fluid can accumulate unevenly. In some cases, this results in swelling that starts or is more severe on the right side, depending on how your body compensates. Over the years, I've seen many older patients dismiss this symptom. They assume it's caused by standing too long or not moving enough. And while those can certainly contribute, persistent or worsening swelling, especially when it's one-sided, shouldn't be ignored. It may be your body's way of saying that your liver is struggling to keep your fluids balanced. Swelling caused by liver problems tends to develop slowly and may be accompanied by other subtle symptoms, like fatigue, a feeling of fullness, or even abdominal bloating due to fluid retention in the belly, ascites. Unfortunately, because these signs are so gradual, they're often missed until the liver is already significantly damaged. So what can you do? Backhand index pointing right if you've noticed swelling in your feet or ankles that doesn't go away or keeps coming back, especially on the right side. Talk to your doctor. Ask for a liver function panel and possibly an ultrasound to assess the health of your liver and check for fluid buildup. And remember, not all swelling is harmless. When it comes with other symptoms like low energy, shortness of breath, or digestion issues, it may be more than just age. It may be a signal from your liver that it needs support. Paying attention now can help you prevent more serious complications later and keep you feeling mobile, comfortable, and independent. 5. White, ridged, or clubbed nails. Have you taken a close look at your fingernails lately? They might seem like a minor detail, but your nails can actually reveal important clues about your internal health, especially your liver. If you've noticed your nails becoming pale or white, developing horizontal ridges, or changing shape, such as curving downward and becoming rounded or bulbous at the tips, these signs might be more than cosmetic. They could indicate that your liver is under stress and not functioning as it should. Let's break this down. One specific change to watch for is known as Terry's nails. This is when most of the nail turns white, leaving only a narrow pink band near the tip. It's often seen in people with chronic liver disease, especially cirrhosis, because the liver's ability to produce proteins and circulate oxygen-rich blood is reduced. This lack of nutrients and oxygen affects the nail beds, causing discoloration and changes in growth. Another important change is clubbing, where the ends of the fingers become enlarged and the nails curve downward. While this can be associated with lung or heart conditions, it's also seen in advanced liver disease, especially when blood flow and oxygen delivery to the tissues are compromised. Over the past decade, I've seen many older patients ignore these nail changes, assuming they were just signs of aging or arthritis. But when combined with other symptoms, like fatigue, swelling, or skin changes, they can be powerful indicators that the liver isn't working well. And because these signs tend to develop gradually, they're easy to overlook until more serious complications appear. So why do these nail changes matter? Your nails are part of your body's early warning system. They reflect how well your blood is circulating, how much oxygen your tissues are getting, and whether your liver is able to produce the proteins your body depends on. When your liver struggles, your nails often tell the story before you feel anything else. Backhand index pointing right if you've noticed pale nails, unusual ridges, or clubbing of your fingers. Don't just brush it off. Talk to your doctor. Ask for a liver function test, and consider a complete blood count and nutritional panel to check for deficiencies in protein, iron, or oxygen carrying capacity. These simple tests can provide powerful insight into what's going on inside your body long before symptoms become severe. And if this information has helped you look at your health a little differently today, I'd love to hear from you. White heavy checkmark, go ahead and click the like button if this video is helpful. Brain, subscribe to the channel so you don't miss more health tips designed especially for seniors. Speech balloon and leave a comment below. Have you noticed changes in your nails recently? Your story might inspire someone else to take a closer look and get the help they need in time. 6. Purple or red bumps/spots on the skin, petechiae or purpura. Have you started noticing tiny red, purple, or dark spots appearing on your skin, especially on your arms, legs, or torso? These small marks may look like minor bruises or harmless skin blemishes, but they could actually be early signs that your liver is in trouble. These spots are known as petechiae if they're very small, or purpura if they're larger, and they form when tiny blood vessels called capillaries break and bleed under the skin. Unlike a typical bruise, petechiae and purpura often appear without any clear injury, and they don't change color or disappear when you press on them. So what does this have to do with your liver? One of your liver's essential roles is producing clotting factors, proteins that help your blood clot properly when you get a cut or injury. When your liver is damaged, such as in chronic liver disease, cirrhosis, or advanced fatty liver, it may no longer produce enough of these proteins. As a result, your blood becomes more prone to leaking out of the vessels, even without trauma. That's when these small spots begin to appear on your skin. I've seen this symptom in many older patients over the years. Often, they thought it was just thin skin, or blamed the spots on bumping into furniture. But when we took a closer look, these tiny marks were linked to underlying liver dysfunction and low platelet counts, a condition called thrombocytopenia, which is very common in advanced liver disease. What's important to understand is that these spots aren't just about the skin. They're a visible clue that something deeper is affecting your blood and liver. If you also experience easy bruising, slow wound healing, or frequent nosebleeds, these are all additional signs that your body's clotting system may be off balance. Here's the good news. If caught early, many of these problems can be managed with proper diagnosis and treatment. But that requires paying attention and acting on what your body is trying to tell you. Backhand index pointing right. So, if you've noticed unexplained red or purple spots on your skin, talk to your doctor. Ask for a liver function panel, a clotting factor test, and a complete blood count to check your platelet levels. These are simple tests that can offer powerful insight into your health. YW checkmark if this information opened your eyes to something new today. Don't forget to like this video and subscribe so you never miss another important health update. Speech balloon, and if you've experienced skin changes like this, share your story in the comments below. It might help someone else recognize the signs in time to get help. 7. Itchy skin without rash, pruritus. Have you ever found yourself constantly scratching your arms, back, or legs, even though there's no rash, redness, or visible irritation? Maybe the itching gets worse at night or after a warm shower, and no matter how much lotion you apply, it just doesn't go away. If that sounds familiar, your skin may not be the problem, your liver might be. Unexplained itching, also known as pruritus, is a surprisingly common but often overlooked symptom of liver dysfunction. When your liver is healthy, it helps process and eliminate bile salts, which are byproducts of digestion. But when the liver is under stress, whether from fatty liver disease, bile duct blockage, hepatitis, or autoimmune liver conditions, those bile salts can build up in your bloodstream and accumulate under the skin. This buildup doesn't cause a rash, but it does irritate the nerve endings beneath the surface, leading to a persistent, maddening itch. What makes this symptom tricky is that it often appears long before more obvious signs like jaundice or fatigue. And because there's nothing to see on the skin, many people mistake it for dry skin, allergies, or even anxiety. In my years working with older adults, I've seen how this type of itching can deeply affect quality of life. Seniors often chalk it up to aging, using creams or antihistamines that provide little or no relief. But when the itch keeps returning, especially without a visible cause, it's worth asking, is this your liver trying to tell you something? It's also important to note that pruritus related to liver issues tends to be worse at night and can move from one area of the body to another. Many people describe the sensation as deep and internal, like it's under the skin rather than on it. This is a classic pattern seen in conditions like cholestasis and primary biliary cholangitis, where bile flow is reduced or blocked. If you're dealing with this kind of unexplained itching, don't just mask the symptom. Get to the root cause. Backhand index pointing right, talk to your healthcare provider and ask for a liver function test, and in some cases, a serum bile acid test. These simple blood tests can detect early changes in liver or bile duct health, even before symptoms become serious. YW checkmark if this information helped you connect the dots. Click the like button to let us know. Brain, don't forget to subscribe so you never miss future health updates tailored for older adults. Speech balloon and tell us in the comments. Have you ever experienced this kind of itching without a rash? Your story could help others realize they're not alone and that it's worth looking deeper. So there you have it, 7 strange but important signs your liver may be trying to get your attention. From small yellow bumps near your eyes to itchy skin without a rash, these subtle changes might not seem serious on their own. But when you understand how the liver works, they become powerful clues. If you've noticed even one of these signs, don't brush it off. These are not just random symptoms. They're part of your body's early warning system. And when it comes to liver health, early detection is everything. The good news is that your liver is one of the only organs in your body that can actually heal and regenerate itself, but only if you give it the chance. That means catching problems early, avoiding further stress on the liver, and making simple changes to your lifestyle. Here's what you can do starting today. Schedule a checkup and ask for a liver function panel. Review any long-term medications with your doctor to make sure they're not overburdening your liver. Start supporting your liver naturally with healthy foods, plenty of water, and cutting back on processed sugars, alcohol, and unhealthy fats. And if this video helped you understand your body just a little bit better, here's how you can help others too. Thumbs up, click the like button. This helps YouTube show the video to more people who might need it. Subscribe to the channel and turn on the notification bell so you don't miss weekly health tips tailored for seniors. Speech balloon, leave a comment below. Have you experienced any of these signs yourself? Or maybe someone you love has? Sharing your story can help someone else feel less alone and take action in time. Your liver might not speak loudly, but it whispers through your skin, your eyes, your digestion, your energy. And now that you know what to look for, you can start listening and responding. Because it's never too late to protect your health. And the best part is, you don't have to do it alone. Stay healthy, stay informed, and we'll see you in the next video.